Hello, I'm Brian Bearfield. Today we'll be talking about attention deficit hyperactivity disorder. Now, you might think, what is ADHD? Well, ADHD is marked by an ongoing pattern of inattention and hyperactivity and impulsivity that interferes with functioning and development. People with ADHD experience an ongoing pattern of these following symptoms. Inattention meaning a person may have difficulty staying on task, sustaining focus, and staying organized, and these problems are not due to defiance or lack of comprehension. Hyperactivity means a person may seem to move about constantly, including in situations when it is not appreciated, or excessive fidgeting, tapping, or talking. In adults, hyperactivity may mean extreme restlessness or talking too much. Impulsivity means a person may act without thinking or having difficulty with self-control. Impulsivity could also include a desire for immediate reward or the inability to delay gratification. An impulsive person may interrupt others or make important decisions without considering long-term consequences. Now, what roles do ADHD play? Well, when in active mode, it usually takes the brain longer to switch off. It also affects the frontal parietal network, which plays a key role in making decisions and learning new tasks. And truthfully, it gives abnormal low levels of neurotransmitters transmitted between the prefrontal parietal area and the basal ganglia. As you can see on the left, we have a normal brain, which calm brain waves. You can obviously see the neurotransmitters are being transmitted evenly. Then on the right side, we see a brain that has ADHD. Now, as you can see from the forehead, in other words, frontal lobe, all the way to the ganglia, it literally shows the different flows from 3 all the way to 0 of different transmitters going through, which is making it harder for them to actually stay focused. Now the genetics of ADHD. Now, ADHD tends to run in families, and in most cases, it's through the genetics that you inherit from your parents are significant factors in developing the condition. Research shows that and siblings of someone who have ADHD are more likely to have it themselves. However, the way ADHD is inherited is to be complex and not through related of a single genetic fault. Another fun fact that I learned is that if you are a premature baby, that you actually have a higher risk of having ADHD. Some progressions of ADHD. Leaving behind familiar environments and supports, we anticipate impairment will increase after high school. Now, for adolescents whose parents are involved in their daily activities who continue to provide support after high school, levels of impairment may be lower and impairment over time may be stable. Alternatively, less impaired adolescents may invite and reinforce parents' efforts at the beginning involved in their daily lives may actually increase impairment levels. Now, adolescents who go to college are probably already less impaired than their non-college intended peers, but college is challenging with heavy academic demands and expectations for independence that may lead to worsening impairments after high school. A foundation of involved parenting followed by continued support in adulthood are likely to be adventurous for students given the challenges of the college content, but young adults in non-college settings face their own settings and challenges after leaving high school and may also benefit from a history of involvement parenting and continuing support relationship with parents. Now, some symptoms of ADHD is impulsiveness, poor planning, disorganization, problem with prioritizing, low frustration tolerance, poor time management skills, frequent mood swings, problem focus on tasks, problem following through and completing tasks, trouble multitasking, has a hot temper, excessive activity or restlessness, and trouble coping with stress. And then let's get into the diagnostics of ADHD. There are three different classifications, two different diagnostics. The inattentive type of diagnostic criteria displays poor listening skills, loses or misplaces items to complete activities, gets sidetracked by external stimuli, forget daily activities, diminished attention span, lack ability of completing schoolwork or other assignments to follow instructions, avoid or declines to begin homework or activities requiring concentration and fails to focus. The other type is hyperactive/impulsive, which is swimming in sea or fidgeting feet and hands, marked restless, making difficult to control, appears to be driven by a motor, lack of ability to play and engage in leisure activities in a quiet manner, incapable of staying in seat in class, over talkative, difficult waiting turn, interrupt into conversations and activities of others, and impulsive blurt out answers before questions before questions are completed. Now there are three different classifications. We have the combined type, which the combined is the inattentive type mixed with the hyperactive and the impulsive. Now with the predominantly inattentive type, the person has passed all the criteria for inattentive, but not all their criteria for hyperactive or impulsive in the past 6 months. And predominantly hyperactive/impulsive, it obviously is the vice versa. The effects of ADHD and exercise. Well, ADHD patients compared to healthy control shows increased brain activity during successful inhibition in the exercise compared to the control condition of parietal, temporal, and occipital regions. But sadly, exercise does not improve behavior. Now, let's get into the management of medication. So, sadly, medication does not cure ADHD. So, when effective, it eases ADHD symptoms during the time it is active. Now, there are two main medicines that are really used, and one is psychostimulant and atomoxetine. Now, atomoxetine has more side effects than psychostimulant, but these two are the most two common medications for ADHD patients. Now, with my case study, I have a 22-year-old student. He played football. He sprained his left ankle twice, once 5 years ago, once 6 years ago. He's had ADHD since the age of 9. He's 67 inches, 151.4 pounds. He wants to join a new gym and says it's hard to actually work out alone due to him usually used to working out with sports teams. He usually works out 2 days, wants to get back to doing his 4 to 5 days a week when he was in sports. His type of ADHD is actually a combined type of ADHD, which means he has both hyperactive, impulsive, and inattentive. He wants to gain weight, get more flexible, and strengthen ankle. Only consideration I have is if he is willing to pay attention to me while I am teaching him and talking him through the exercise test. So, the exercise test that I'll be using is a movement screen called the functional movement screen. It is a way of analyzing a person's movement patterns and observing mobility and stability. The purpose of the movement screen is to help our clinics and therapists identify any ligaments or asymmetries that may increase the risk of injury. There are 7 different tests. So we have deep squat, hurdle step, inline lunge, shoulder mobility with a shoulder clearing test, active straight leg, trunk stability push-up with a spine extension clearing test, rotary stability with spinal flexion clearing test. Now, with the FMS, they have a scoring sheet of in between 0 and 3. They have pictures and descriptions of the pictures to actually show and explain to you how you will be grading your person. Now, you can literally use this test with anybody from the ages of 11 all the way up to 90 because it's safe for everyone. Now, after seeing my client go through an FMS, which he scored a 16, which is an amazing score, I would prescribe him four exercises a week, 4 times a week, between 30 minutes to an hour a week with a personal trainer, and 1 day by himself. I say this due to the fact that he has ADHD and may zone out while between workouts, so the 4 days with the PT will help him go into a good flow, which means that by the 5th day, when he's working out by himself, he'll have a great flow for himself. I'll give him a mixture of aerobic, strength, and conditioning. So he'll have aerobic all 5 days, he'll have strength 3 days, and he'll have cardio 2 out of the 5 days. In conclusion, even though some people have a disability, does not mean that they cannot work out. Yes, it might be harder for them, but if you make it work, especially for them, and give them a personal trainer, it is the easiest way for them to succeed. It does not matter if you have a disability or a disease. With the right exercises and a great trainer, you can always work out and make your body feel great.